Hi, my name is Roger Plotho, and this is my final presentation for the SNHU class on globalization. And the topic I've chosen is universal health care, particularly looking at the reasons why the United States of America is the only country of the developed world that has not adopted a form of universal health care. There are 58 countries across the planet that have done so, but the United States has not. And I wanted to understand why that was the case, and so that's where I spent the majority of my time doing my research, and that's what we're going to be talking about today. First of all, it's important to get a little background on healthcare in general. Healthcare accounts for 20% of the American GDP. This is a huge thing that affects all of us, obviously, beyond just the fact that it involves our lives and the quality of our lives and how long we live. It is a consumer of resources. It is 20% of our economy. So understanding healthcare and healthcare systems and understanding the differences between the American system and other systems across the country and how they might interconnect, I think, is vital to being able to engage this conversation. What is universal health care? What does it mean? What's the definition? The World Health Organization defines it this way: a system that ensures that all people obtain the health services they need without suffering financial hardship when paying for them. That's the basic definition. So everybody in a country has access to health care in a way where they can afford it. 58 countries, according to the World Health Organization, have achieved that in one way or another. There are as many ways to go about it as there are countries that have done it. So what is it that's unique about the United States that causes us to not have universal health care? First of all, I consulted a number of experts in medical sociology, experts in medical economics, consulted political scientists, to try to get the picture of the circumstances that exist here in the U.S. One of those experts, one researcher, said that it's his view that it's almost inevitable that the United States will eventually adopt some kind of universal health care plan for this reason. Any country that spends 20% of its GDP on health care will eventually look at that and say, there are other things that we would like to spend our money on as well: infrastructure, education, etc. And so, at least in his view, at some point, the United States will come to a universal health care program. Let's look at, for just a moment, what possible reasons there are for the U.S. not having done so at this point. One theory could be that, well, we already have a highly efficient system, and to take that system down or to change that system significantly would be a mistake. In fact, the experts that I consulted on this, including two medical economists, refer to the American system as uniquely inefficient. In other words, it has aspects to it that are not only inefficient, but contain inefficiencies that are unique to our country. So there's some basic empirical data here. The United States spends more than $8,000 per year per capita on health care. That's double what many countries spend on health care. So you might say, well, but we have a better system, and so it's going to be more expensive. Part two of that question then is, what do our outcomes look like? And in fact, again, looking at a number of researchers, what they have found is that not only do we spend more, but our outcomes are worse than many other countries. One study included 11 countries, and we came in number 11 in outcomes. And when I talk about outcomes, we're talking about longevity, lifespan. We're talking about overall health. We're talking about specific outcomes. When you have a disease of some sort, you go in for treatment. What's the outcome of that process? Do you survive it? Do you come out of it better? When you look at all of that, the U.S. doesn't have good outcomes compared to many other countries. So it could be then summarized that we, as Americans, have the most expensive healthcare system in the world, and yet one that doesn't deliver the kinds of outcomes that you would expect for spending that kind of money. So we've now looked at this through the lens of economics. What we've talked about also involves looking through the lens of sociology. How do people expect to live their lives? And sociologists consulted for this paper acknowledge that Americans want choice. Americans, and we're going to talk about this a little bit more in a few minutes, but Americans don't like the idea of socialism. And anything that starts to sound or feel like socialism becomes a big problem. Again, going back to the fundamental research and the conclusions reached by the people that I consulted, the papers that I consulted, peer review papers that I consulted to put this project together, all of those that I read indicated that it was their conclusion that universal health care cannot be achieved without the government playing a central role in the process. And so here you now get to the issue. If that's true, and we'll talk about whether it's true or not before this presentation is over, but if that's true, what you are talking about is a form of socialized medicine. Well, Gallup polls tell us that only 30% of Americans have a favorable view, a positive view of socialism. So 70% of Americans don't like socialism and don't like what it stands for. Well, so you now have a conundrum between those researchers who say you're not going to get to universal health care without some kind of socialized medicine, and the American public that generally doesn't like that idea of socialism. So there are two possible outcomes here. One, the United States isn't going to get to universal health care anytime soon, or two, we are going to find some unique way of getting there while utilizing in some fashion the marketplace, so that it's not a socialized program as we have come to know it in most of the other 58 countries that have achieved this. Here's an interesting note. Gallup found that 70% of Americans are generally satisfied with their personal health care, which is not a bad number. It's lower than the same question if you ask a Canadian or someone in France or Germany or Great Britain. They generally tend to be more satisfied with their health care. But 70% of Americans are generally satisfied with their health care. However, only 32% say that the overall American health care plan is satisfactory. So even though they may feel like they're being taken care of as reasonably well, they are acknowledging, it seems to me, that it's not that the overall system isn't what it ought to be. You would not expect it to turn out that way, except that I think that what it indicates is Americans, I think, despite their reputation, do care about other people. They care about their neighbors. It's not just about all me all the time. And if they recognize that I'm okay but others aren't, they're not happy with that situation. So, the United States probably has one of three options to choose from. One, the status quo. We sort of move in fits and starts toward reforming healthcare in bits and pieces. Two, we find a uniquely American solution that creates universal healthcare that includes the marketplace. Not out of the question. We've done things like this before. We are a very innovative country. Three, this is an opportunity for us to learn from other countries that have already done this, borrow from them where it makes sense for us. The problem with the free market in healthcare is that free market and universal healthcare don't really work together. To the free market, universal healthcare is not a rational thing. You have to make certain decisions in finding ways to cover uninsured people, low-income people, people who are who might incur a huge expense. The rational thing is to put caps on that, to expect people to pay you, and if you are doing that, you're not getting to universal health care. And so the free market operating on its own seems unlikely to get to universal health care. So how do we get the word out? How do we talk about this? How do we engage this? You would think that the internet would be a good thing for this. The problem with the internet is that it is so full of bad information that it's hard to separate good information from bad. And so there needs to be an all of the above process engaged by all of the stakeholders in this issue. And there needs to be a process created by which we can separate good information from bad. We often hear that politicians say, well, the United States already has the best healthcare system in the world, when empirically, just by the data, that statement is on its face not true, unless you create some kind of a tortured definition. So it's organizations like the Kaiser Family Foundation, like the WHO, need to be engaged in all manner of communication, social media, various parts of all parts of the internet. It needs to be, BuzzFeed needs to be engaging this. This needs to be an all of the above approach to getting information about healthcare into the hands of the stakeholders, which is every American. Whether we're healthy or not, whether we can afford insurance or not, how this turns out matters to all of us, because if we can solve it, we can open up resources that may be put to other uses. This is one of the big issues of our time. I don't think anybody would dispute that. There is a lot of research out there about it. Sociologists have tried to understand it. Why Americans approach it the way they do. Political scientists are trying to understand it. Economists are trying to understand it. It's probably time that more Americans try to understand it and try to understand the big picture when we talk about not just am I covered, or is my neighbor covered, or are my children covered, but what do we need to do to address the empirical facts that we spend more and have poorer outcomes than many other countries? And is there a uniquely American solution to that, as we have found before in approaches to very difficult issues? There very well may be. Here's the bottom line. The U.S. lags behind other countries in creating universal health care. We have many people who aren't covered. Most Americans, I think, recognize that the overall system isn't as good as it should be. And a variety of factors have led to this situation that are difficult but not intractable.